You're all set, Chancellor.
Uh, Hello, everyone. Thank you for your patience as we now get into the meeting that we promised you. I'm sorry to be slightly delayed, but this was a technical challenge, and happy to be with you. Obviously, we want to have to be able to answer questions and understand some of the issues that are before us. But I will point out that Anthem was selected as our preferred administrator. That was earlier this year following a competitive RFP process. Anthem was selected as the preferred administrator to begin coverage in January 2026. Since then, Anthem has been in negotiations with Northern Light Health that could impact our coverage. And while we hope they reach an agreement, we have received assurances that all elements of our contract, including our network status, will be upheld. We are confident that these protections will safeguard our employees and their families. With that, we are moving forward with Anthem as our administrator as a result of the RFP process. I want to thank you to the HR and benefits operation. I want to single out the system for the care that they are taking and the concern that they are sharing. And as we work through this process, we feel that we are in fact making progress. And I and others are in regular discussions with Anthem as this process continues. I'd like now to turn it over to our CHRO, Amy Parker, for related updates. Amy?
Great, thank you, Chancellor. So good afternoon. I first wanted to start by sort of describing why we're doing this in this format. We did solicit questions over the past few days and the past couple of weeks through our UMS HR email that I will respond to a number of them today. And then hopefully following today's presentation, if more questions arise, and we have some time to look into those, we will again meet on October 23rd at 1 p.m. to not only sort of repeat this presentation for folks that could not make it today, but also answer some additional questions as they arise. So I want to thank you for joining me in this presentation to share with you information about the University of Maine System's transition to a new health and prescription vendor beginning January 1st, 2026. I'm going to start today with providing you with some background information for context, and then I'll follow this up with responses to some of the questions that have arisen. So this process started about 10 months ago, and we've spent several months carefully and thoughtfully reviewing our options. And so today I'll share what we learned and the commitment that we're making to support the health and well-being of our employees, our pre-65 non-Medicare eligible retirees, and your families. In early 2025, as I mentioned, we began a months-long request for proposals or RFP process. And we had employees on this team representing UMS HR, finance, strategic procurement, and our union partner. Throughout the process, we also engaged with the Employee Health Plan Task Force, which is a group comprised of employees from across the system and our unions. And I want to be clear at this point that while we kept them apprised, this decision is a management decision and was made by the University of Maine System. Additionally, we worked with our partners at Maine Healthcare Purchasers Alliance and Willis Towers Watson to inform our decision-making. Our desire was really to have an inclusive process, which was grounded in transparency and objectivity. I just want to remind everyone that RFPs are required for public employers because they're a built-in safeguard for how public funds are spent. These rules exist to make sure that decisions are made in a way that's fair, transparent, and results in the most comprehensive health and prescription coverage for you and your families, and at the best price. So here you'll see a high-level outline of the process that we engaged in. From bid development to scoring, interviews, and final selection, we were focused on one overarching theme. We wanted to find partners who would deliver value, access, and quality outcomes for our members. And this mission shaped every decision that the team made throughout the process. For this process, we were seeking what is called a third-party administrator. A third-party administrator is often referred to as a TPA, and they're a company that helps self-insured employers like UMS manage their employee benefit plans by handling the paperwork, the claims processing, and other administrative tasks related to health insurance coverage. Through the questions that have come in the last few weeks, it's become clear to me that some folks have not understood about our relationship with these third-party administrators. The third-party administrator, which is Anthem in this case, does not insure the employees or pay claims using its own funds. Instead, it uses the University of Maine System funds to pay for approved medical claims. So to be clear, Anthem is not our insurer. UMS is self-insured. This means that UMS takes on the financial risk of providing benefits by paying employee medical and pharmacy claims through the administrator, Anthem. We then engage in cost sharing for these expenses with our employees through premiums that are deducted from paychecks. This is why managing our health and wellness is critical. We have a responsibility to get you the best care and manage our shared healthcare costs. So after a comprehensive evaluation, we selected Anthem Blue Cross and Blue Shield of Maine as our new medical third-party administrator, and here's why. Anthem received the highest evaluation score. They met every mandatory requirement across service, compliance, and benefits administration. Their pricing was competitive and was reinforced by strong performance guarantees and results in significant savings in comparison to other plans. We found that they take an innovative approach to individual health. They use technology and care coordination to improve outcomes, especially in underserved rural areas. They are known for offering excellent member support and access for members for real-time claims data via their online portal. And this transparency allows you to see exactly what was billed to ensure that you're not being billed for services that you did not receive. Additionally, they will be attending in-person enrollment sessions and are providing printed cards for members. This is in response to feedback that these features are important to our employees. Anthem has committed to support UMS-based nursing scholarships, helping us further invest in Maine's healthcare future. We are committed to supplying talented healthcare providers to our health systems within the state of Maine to expand access to quality care and addressing a much needed shortage in our state. I want to just point out the Net Promoter Score. A Net Promoter Score is something that serves as a key indicator of customer loyalty and the likelihood of recommending services. So if you've ever been asked on a survey, how likely are you to recommend this company or service to a friend or family member, that is what results in a Net Promoter Score. Anthem's recent Net Promoter Score of 78.3% demonstrates strong advocacy and customer loyalty. And their Net Promoter Scores, actually any Net Promoter Score over 70 is regarded as world-class regardless of the industry. And additionally, their customer satisfaction score for 2025 to date is approximately 90%. So these were all factors that we took into consideration. This infographic highlights Anthem's impact on access and experience throughout the state. Anthem currently has more than 370,000 members in Maine and has had a presence in Maine for 87 years. 507 of their associates supporting our employees are based in Maine, and nearly 20% of those associates are proud graduates of the University of Maine System. Anthem provides us access to the state's largest network, including over 6,500 doctors and 32 hospitals, and 98.5% of their claims are paid in network. Another aspect across the selection team that we found reassuring is that Anthem currently partners with the state of Maine to provide insurance to their employees. So I just shared a bunch of information about network access, and so I think this is an important point to pause and address the ongoing negotiations between Anthem and Northern Light Health. We understand that this situation has created uncertainty for many. Unfortunately, what we understand is that disputes of this kind are becoming more common as healthcare costs continue to rise nationwide. The rates that are negotiated between insurers and healthcare systems, or third-party administrators and healthcare systems, directly affect what members ultimately pay. It is essential for organizations like Anthem to seek fair pricing to help control costs for members. And at the same time, Northern Light must secure adequate funding to sustain its services and maintain a strong presence in the state of Maine. So at its core, this dispute reflects the broader challenge of healthcare affordability across the country. The relationship between Anthem and Northern Light is important to both organizations, and we do remain confident that an agreement will be reached before any impact to our plans on January 1st of 2026. In the unlikely event that it is not resolved by then, we are preparing to negotiate with our unions regarding the potential impact of this change. Finally, I received a number of inquiries from those who are receiving care out of state and were concerned about the impact to their network. It's important to note that while Anthem Blue Cross and Blue Shield is based in Maine, they are part of what is known as the Blues network of Blue Cross and Blue Shield, meaning that we can access their nationwide network. I'm going to transition to our new pharmacy benefit. Historically, the University of Maine System has integrated pharmacy benefits. But through this request for proposals, we wanted to take a fresh look and explore the option of what is known as carving out of pharmacy. This slide emphasized Anthem's openness and willingness to partner with us in that direction. They understood our goals and they showed real flexibility in working across vendors to make this initiative successful. Working to control pharmacy expenses, which are significant, was a primary driver in our decision-making process. I mentioned earlier that transparency from our administrators is important to us. In pharmacy benefit management, data transparency means that the financial and operational aspects of managing prescription benefits is visible and understandable to employers and its members. Your personal health information remains protected and is not visible to the university. But by carving out pharmacy, we separate drug spending from the broader medical plan and negotiate directly with a pharmacy benefit manager. This gives us greater visibility into actual drug costs, rebates, and pricing practices, which reduces the hidden markups that can occur when pharmacy costs are bundled into medical claims. These insights and savings help us better manage expenses, which can translate into lower premiums or slowed growth in premiums for employees and their families. We recognize that prescription costs are among the most significant healthcare expenses that many families face. The pharmacy administrator we selected is Capital RX, which is currently rebranding to Judy Health. Several factors made them stand out. They have a straightforward, flat administrative fee with no hidden markups. We will experience a projected 15 to 20% savings in the first year for both UMS and our employees and their families. They have a fast, secure, and highly rated claims platform and a 24/7 member support and dedicated account team. Their plan offers flexible plan design with full data transparency, again, protecting your health information. And they have a strong commitment to working closely with the University of Maine System and Anthem to ensure a smooth transition. Most importantly, they offer a comprehensive set of clinical programs focused on whole person care, patient safety, and cost management. A key reason that we felt confident moving forward with a carved out pharmacy benefit was the strength of Capital RX's overall offering. They have advanced technology, a vast pharmacy network, excellent customer support, and top-rated net promoter scores that all played a big role. So again, that net promoter score is very important because it signals how others who have used the services have responded to that service. Additionally, there are strong privacy protections, and industry-recognized data certifications demonstrate their alignment with UMS's goals to protect your data and health privacy. Unlike traditional pharmacy benefit managers that use less transparent pricing models and may steer towards higher profit margins, Capital RX offers a flat administrative fee. So as an example, regardless if the drug cost $50, $500, or $10,000, the administrative fee is $7.25, unlike other integrated solutions where the pharmacy markup is based on a percentage of price. And you can tell from that model that there would be potentially an incentive to offer a more expensive drug, whereas the flat fee does not offer that incentive. That means, again, no hidden markups and more predictability for our plan. They also benchmark drug pricing using the national average drug acquisition cost, which reflects real-world costs and ensures that employees and their families get the lowest price prescriptions available. We believe that these strategies are going to help keep things more stable and fair for our members, their families, and the plan, which is critical for us at this point in time. I'm going to be very clear about the cost. If we made no changes for 2026, our costs were estimated to be $101.6 million. By moving to Anthem and Capital RX, our costs are estimated to be $95.5 million. While this move to Anthem still represents an increase of 4.5%, this change enables us to slow growth in 2026 by just over $6 million. This is a cost that's shared by employees and the university system. We believe that this decision is part of our responsibility to our students and their families by keeping their tuition costs lower, and to our employees by responsibly managing healthcare's increasing costs. Also important in our upcoming enrollment and other health and welfare benefit plans, and these were questions asked by individuals over the last couple of weeks, are dental, which is Delta Dental, and eye care, iMed programs are not changing in 2026. Fertility benefits will continue to be offered, and they will be offered through Anthem. Hearing care will continue to be offered, will be offered through Anthem in partnership with True Hearing. We will continue to offer health savings accounts for those who selected the high deductible health plan, and we will continue to offer flexible spending accounts for health and dependent care expenses. So we recognize that these are important benefits for the health of you and your loved ones. And while we haven't been focused on this, we will certainly talk about them and be able to answer questions during open enrollment sessions, as they will continue into 2026. So to recap, we have selected 2 new administrators for January 1st, Anthem for medical and CapRx for prescriptions, based on their performance, pricing, and shared commitment to improving member care. We are confident that these partners will support our employees and retirees through the transition and will help us achieve long-term sustainability and better health outcomes. We are going to continue to monitor negotiations between Northern Light Health and Anthem, and again, we'll negotiate with our unions the potential impact to employees who use Northern Light Health. I would like to turn it over to our Director of Total Compensation, Carla Varnum, who you may know or may see in the coming weeks, to talk about our enrollment informational sessions.
Thank you, Amy. Thank you everyone for joining today. I really appreciate you guys attending this session and hearing about this important transition that we're doing. In recognition of how much value we put behind the benefits, we bring and offer to you, we want to be available to you. So we're traveling the state for the first 2 weeks of open enrollment, essentially, and will be available at these campus locations. There is a registration option available in the transition guide that was provided in the Chancellor's message. It is on the same question that these sessions were posted in, and we encourage you to register in advance so that we can prepare and plan accordingly. We will have our other benefit vendors join us as well, and they'll be offering swag and information so you can talk about all different types of benefits. And for those who can't attend the live sessions, we will be offering 2 separate Zoom sessions in a webinar format, so questions will be offered as well. All right, and as mentioned earlier, we have additional resources. We are updating the health and benefits transition guide as we get questions in. So we encourage you to go to that, refer to that, bookmark it, and we'll keep updating that, and to continue to send any questions regarding the transition to the email posted below, umshr@maine.edu. And for any just general benefits related questions, reach out to the benefits team at benefits@maine.edu. Thank you.
All right. I want to thank everyone who is viewing today. This session is being recorded for those who cannot join us. And again, if you would like to submit additional questions, we will broadcast again on October 23rd at 1 p.m. We will update our transition guide with answers to questions, and also we'll make sure that we address many of them that come in over the next week as we move forward. And that concludes our session for today. Thank you, everyone.